When I go to a social setting and I say that I'm a sleep specialist, I usually have everyone coming to ask me questions about their sleep, which I'm glad to help with, but it's really on the mind of people a lot. And so our research focuses on how to recognize sleep problems and how to improve what we know how to do about them. We find that many parents have unanswered questions or concerns about their children's sleep, and for good reason. Parents realize, even sometimes when doctors don't, that how a child sleeps could have a lot to do with how they're going to behave the next day, and that could have a lot of influence on the quality of the day for the whole family. Everything that you need to be healthy relates in some way to sleep. So the questionnaire that Zansors plans to make into this app called Sleep Champ focuses on sleep and breathing problems and possible outcomes of that, and meaning behavioral problems such as hyperactivity or inattention or daytime sleepiness that children can develop when they have sleep disorders. If you're a parent and you would fill this questionnaire out with regard to your child, if a lot of the symptoms are positive, in other words, you think your child has them, then it might raise the possibility that your child would really benefit from going to a pediatrician and discussing them to see whether a sleep disorder might be diagnosed. Sleep apnea in particular can affect many different aspects of health: thinking, behavior, mood, and of course daytime sleepiness. We perform a lot of different kinds of research here at the University of Michigan with regards to sleep and health and how they interact. My own particular focus has been on children largely and on sleep disorder breathing. One of the things that interested me most when I started out in sleep medicine was that children, in contrast to adults, when they have sleep disorders, don't necessarily come and look really sleepy. In fact, they can look like they're bouncing off the walls. And in fact, some of these children with sleep disorders become diagnosed with ADHD and can be treated for years with a stimulant before anyone realizes that what they have and are suffering from at the root of the problem is a sleep disorder. SRBD stands for Sleep-Related Breathing Disorders Scale. The instrument consists of 22 question items based on symptoms that are common in children who have sleep problems and sleep apnea in particular. It started out as a research project, actually, and we designed a very general questionnaire with a bunch of questions about all things that have to do not only with nighttime sleep, but with daytime behavior, cognitive function, thinking, as well as other symptoms that people might not realize are tied to sleep apnea in children in this case. I was excited to hear that Zansors could potentially make the questionnaire into a user-friendly kind of app and possibly get parents and families aware that, first of all, sleep disorders exist in children, sleep problems exist, that there's something to be done about them, they can be diagnosed, that they can be treated. There really is quite a bit of help that's available now. We know much more about sleep disorders, sleep problems in children than we did 10 or 20 years ago. There's a lot that's unknown. We can go outward looking into the universe for the unknown, but we can also go just straight into our heads and find a fascinating universe there that awaits exploration. People haven't studied sleep for decades in the way that they are recently, and so it's a new and emerging field with exciting information that's coming out on how to help people live healthier and better lives.